Today I'm really pleased to be introducing and hearing from Dr. Christine Mayhew and Mrs. Maureen Parkinson. Just to give you, before I introduce both speakers, I'll give you a bit of a background on the format. So how it'll work is we'll hear from the speakers, and then after they finish, we'll open up the floor for discussion, both in site here in Toronto, and for those connected remotely as well. Everyone's welcome to participate. So now I'd like to introduce the speakers. So Dr. Christine Mayhew and Ms. Maureen Parkinson will be presenting on Cancer and Work, a new interactive website for cancer survivors, healthcare providers, employers to support cancer survivors with staying, returning, or looking for work. Dr. Christine Mayhew is an associate professor in the Ingram School of Nursing at McGill University. Her research is focused on cancer survivorship care with special interest in psychosocial oncology, clinical interventions. Dr. Mayhew is a co-principal investigator on the Fear of Recurrence study holding funds from the Canadian Cancer Society, sponsored from the Canadian Partnership Against Cancer. She currently leads a team on the creation of the Cancer and Work website to address the needs of cancer survivors, healthcare providers, employers in returning and staying at work following cancer. Ms. Maureen Parkinson is the Provincial Vocational Rehabilitation Counselor at the BC Cancer Agency and the co-lead for the CPAC-sponsored Cancer and Work project. She has also been a vocational rehabilitation counselor at Public Rehabilitation Hospital and vocational rehabilitation consultant to insurance companies and the court system. She's instructed and facilitated Service Canada-funded programs on job search and career exploration. She has a master's in counseling psychology and is Canadian Certified Rehabilitation Counselor and completed the Certified Return to Work Coordinator program through the National Institute for Disability Management Research. She's developed return to work and job search seminars for cancer patients and created the guidebook Cancer and Returning to Work, a practical guide for cancer patients, as well as online articles about returning to work and school. She's also co-authored a paper commissioned by the Canadian Association of Psychosocial Oncology, Cancer and Work, a Canadian Perspective. So we'll be hearing from both presenters today. We're really delighted that they could be with us today. So at this time, Christine and Maureen, I'm going to hand the mic off to you.
Okay, thank you, Jackie. And thank you for this introduction and for inviting us to discuss how to navigate the Cancer and Work website, and also for us to introduce some of the resources and the tools to assist for cancer patients and survivors and healthcare providers and employers in returning to work and staying at work. And it's a pleasure to introduce this website to you and particularly highlight some of the parts of the website that we feel are going to be helpful for individuals working in psychosocial oncology. Before we start, we'd like to acknowledge our funders, the Canadian Partnership Against Cancer, and this website was created in partnership with the D'Souza Institute. Next slide. So on the presentation, we'll provide some background in terms of how the website was created, named Cancer and Work, a little bit about us, who's behind the website, and we'll present some different aspects and overview of the cancer website, some of our evaluation that we're currently doing and going to do, and some of our next steps. Next slide. Maureen?
Just in terms of background, what the research is telling us, 62% of those with cancer return to work in the first year, and the rate of return after 4 years has been found to be 85%. But that said, we know that for some there's some challenges. 1.5 of cancer survivors who return to work, or 1.5 cancer survivors are more likely to be unemployed, and between 26 to 53 quit or lose their job over 72 months post-diagnosis. That said, 23 to 75% of those who lost their job are reemployed later. But this does suggest that there needs to be support and information to aid in return to work, staying at work, and finding new work. Next slide. So the call for proposal to create the website to aid in return to work stems from 3 studies by the Canadian Partnership Against Cancer. One looking at resources out there for cancer survivors, and the other and other disabilities such as mental health, and they looked both nationally and internationally. They conducted an online survey of cancer survivors and their caregivers, and also conducted some focus groups where they asked about their challenges and needs. They also surveyed employers and employer representatives to see what their challenges were and how they addressed these challenges. Thereafter, CPAC convened a national meeting with those involved in practice and research in cancer work in Canada. And the end result of the meeting is recommendations to focus on creating and providing interactive tools and education to assess work demands and function, enhance communication between stakeholders being survivors, employers, and healthcare providers, and drawing on the already available resources within cancer and other disabilities. And if you'd like to learn more or see these CPAC reports, they're available on www.cancerview.ca.
So, next slide. So in December 2014, CPAC sent out a request for proposal whereby Maureen and I, in partnership with the D'Souza Institute and some of our core members, we were tendered this professional service contract to develop this online platform, Cancer and Work. And so with a team of rehab specialists and researchers from 2 cancer centers and 3 universities, we started on this project that you will see after a while took a life of its own that Maureen will describe. And early on for the application, we also sought community partners to come on board with us. And so we have the Canadian Cancer Society, Canadian Cancer Survivorship Network, the National Institute of Disability and Management, who also provided input to the website and help us to reach out to other Canadians to provide input on the content development and to help us advertise the availability of the website. And we have other additional community partners that came on board during the project, and we'll introduce them later. Next slide.
So about 6 months into the project, we felt the website would be even better if we drew on experts from across Canada to write on topics relevant to work in cancer. So we invited 26 expert writers on the topics of psychosocial oncology, vocational rehab, occupational therapy, nursing medicine, employment and insurance law, disability management, human resources, and union concerns. And you can see the highlighted names on that slide, and it's showing kind of the cross-section of the experts that we drew on. As well, we invited 25 advisory group members representing survivors, healthcare providers, and that included social workers, physicians, rehab specialists, and employer representatives such as human resource specialists, disability managers, and insurance representatives to help guide the project and review the materials to ensure the information was accurate, helpful, and important. And again, the highlighted names represents the cross-section of representatives from these stakeholder groups. Run the next slide.
Thank you. So to begin building the website, we first conducted a big literature search and a grade search, and we soon realized there were many topics that were coming up, and we felt that perhaps we should try to prioritize given the length of the grant period and the funding. So while the focus was to provide a hub for Canadians to access helpful national and international information, we also realized there were a lot of gaps, and we ended up having to write a lot more than we had expected. So we also decided then to conduct this online survey to help us prioritize the topic and to also seek within the communities if there was other resources they were using within their context that we could feature on our website. And we also used that as an opportunity to announce the coming website while it was being constructed. And so overall, we had over 200 individuals who completed the website, and this was made possible through our community partners who had sent out this request to complete the online survey to their members list. And as a result, they indicated that all the topics were a priority. Some of them will be presented next, but some of the examples of topics that were assessed in the survey was how cancer and its treatment can affect my ability at work. So we asking if that was important, understanding the roles of the different healthcare professionals in helping cancer patients return to work, and staying at work. Next slide.
So moving on to the content of the website, here's a list of the section heads on the website. We designed the sections so that they were parallel sections for all stakeholders, the cancer survivors, healthcare providers, and employers. We did this to enhance communication between all of those involved by using similar processes and their roles in these processes and using the same language and the similar headers. For survivor section, we added 2 extra sections, one on changing work and looking for work, for those who were not working and needed to change jobs. We also added a section on caregivers for all stakeholders. Next slide.
So here's an example under the Cancer Survivor section, a section that's called Returning to Work and Staying at Work, and it's presented using a 9-step approach. And this section is similar with the survivors, healthcare providers, and the employer section. So as an example here under step 1, you have understand your current abilities, and this is in relation to building their return to work plan. Survivors are encouraged to self-assess their physical, emotional, and their cognitive abilities and to reflect on how these might affect their ability to work. Another example under step 6, develop a return to work plan. This section informs survivors of likely questions that an employer may ask while creating a return to work plan, such as wanting to know an anticipated start date for the return to work, what are some of the limitations, if any, and some restriction and an adaptation that may be needed. Next slide. So under this section, Cancer Survivor section, Cancer's Impact on Work and Strategies, in this section, individuals will find information on over 20 different types of cancer and its treatment effects, including long and late effects of cancer. And within each of these sections, there's a description first of the symptoms, such as here lymphedema, that's followed by vocational employment implications. Then as this site was built in collaboration with nurses, nurse practitioners, occupational cancer health professionals, we also extended it to build a what can you do section that presents self-management strategies such as tools to self-assess and resources to help. We then added a section on job accommodation to present suggestions on how these symptoms can be accommodated within the context of work. So for example, in this slide with lymphedema, which is a swelling of either an upper part or lower part of the body that may restrict movement and may cause pain, it is suggested to wear a compression garment that may reduce the swelling and the numbness, to reduce physical repetitive tasks, and if sitting at a desk, perhaps to consider elevating the foot or the ankle if the swelling is in the leg. So this section was developed using an interdisciplinary approach that was led by myself, along with Rosemary Cashman, a nurse practitioner from the BC Cancer Agency, Carla Johnson, an occupational therapist from the Jewish General Hospital, where we focus on providing she specifically focused on providing suggestions for job accommodation. And then we had Maureen, who has our provincial vocational rehab counselor representative, completed the vocational implication. So under the Cancer's Impact on Work, we also have a section called Emotional and Psychological Impact, and this has been created and is still going under some review from 2 psychiatrists that we recruited from the Cancer Care, which are Dr. Mark Katz and Dr. Bates. Next slide.
So based on the clinical experience at the BC Cancer Agency, where survivors often express the concerns about coping with stress at work, particularly in light of their fears of stress in relation to cancer, we created the Workplace Wellbeing section. This section includes ways to address stress, including introducing into the strategies to improve their resiliency. So in particular, we had a psychologist, Dr. Christine Corbisson, develop an online tool and videos teaching cognitive behavioral therapy techniques to address their work concerns. We also, under the section of law, policy, and practice information for survivors, in one section we have several lawyers answer frequently asked questions, often posed by survivors related to human rights support as it relates to return to work or finding work. The questions like, do I need to disclose my cancer in a job interview, or can I lose my job if I tell my employer I have cancer? Besides listing the vocational rehab programs that are specific to oncology, such as the provincial program at BC Cancer Agency, the Wellspring programs, and the Ontario Pediatric Oncology Group program called SATV, which is the Successful Academic and Vocational Transition Initiative. We also on the website include employment and vocational rehab programs that are available in each province. So it's the generic programs that potentially can provide support for those with disabilities. As well, in the healthcare professionals, on the website, we provide ideas on self-assessment tools for survivors to discuss the different types of, and we discuss the different types of professional assessments to address physical, cognitive, and emotional functioning, to inform the discussion with healthcare provider and to help the healthcare provider, particularly the physician, with determining readiness for return to work or need for more time for recovery or limitations and restrictions that may need accommodations. We also provided 2 videos, one to inform those working in oncology of the research on work in cancer, and another to give a basic introduction to a vocational rehab model to give them some ideas of factors to consider when providing an assessment for vocational rehabilitation purposes.
So on this slide, under the healthcare professional section, there's a tab called Returning to Work is Communication and Teamwork. And here under this section, we're saying how important it is to talk to your patients about returning to work well before they feel ready to go back to work. And this is a way to anticipate and address any challenges early on. We also describe how healthcare providers can provide guidance on the patient's expected recovery time, limitation and adaptation they may need as part of their return to work. And we do explain that planning to return to work is a process. So talking with all the parties involved early on in the cancer treatment can ease that transition back to work and make this return to work successful. And as you know, some studies are showing that when employees are feeling supported by their workplace and their healthcare team, that these are important factors in a successful return to work. So planning collaboratively will more likely result in a successful return to work. And some of these planning processes involve assessing and providing information about the survivor's current abilities. Here, healthcare providers should consider reviewing what their patients' job demands are by encouraging them to complete a job analysis form that's available on their website if one is not available at their work, helping the patient to anticipate challenges and discussing them how to address it, monitoring the survivor's progress after they have returned to work, and then addressing any new or ongoing challenges. And here, physician, part of determining a patient's readiness to work is understanding what supports are available at their workplace and how the return to work process is usually handled. Next slide.
We're excited because in the last month, we just included a video by Faith Heyman, who's a lawyer for British Columbia who specializes in long-term disability. While this video is directed to physicians, she does speak about how insurance providers view medical notes and information differently from healthcare providers, so it's worth being reviewed by all. She discusses the different perspectives between physician and insurance and provides 15 steps to improve communication. And of note, she highly recommends using assessments, even self-report tools, as featured in the Cancer and Work website, as a way to improve communication and support claims and medical notes to insurance providers. She also discusses how to address tough issues on claims for things like psychological issues and pain. Next slide. I think that's you, Christine, or
you wanted to take it?
Okay. So, sorry. So also was featured as the Return to Work Planner. It was 6 steps created by one of our core team members, Dr. Mary Kita. What is notable with the employer section are sections on developing return to work plan, cancer and teamwork and job accommodating ideas, and Dr. Kita's workplace accommodation. And here, Dr. Kita, who's one of our core team and head of the occupational department, has created 2 videos for employers on developing workplace accommodations following cancer and how to talk about cancer, stigma, and workplace discrimination. Building a return to work plan, she recommends building a return to work plan should be done early on in the process. And she describes 3 guiding principles for all stakeholders in building return to work plan. The return to work plan should be individualized. A return to work plan should vary from one person to another. Each return to work plan should be based on the employee's specific abilities and restrictions, and there should be no cookie cutter approach. A return to work plan should also have feedback by all involved to pull together the plan so that it makes sense and is going to work for everybody's perspective. So she also recommends clear communication as well between all parties so everybody understands and is on the same page. And the plan should be flexible. While the plan must give the return work process some structure, it must be flexible to encourage, to respond to any changes that the employer may need, an employee may need. And we're on the next slide.
So under this section that is also included in the survivor section and is part of the healthcare section and the employer, this section deals with the accommodation ideas for specific common cancer symptoms and treatment side effects. And this was developed by Carla Johnson, that I introduced earlier, an occupational therapist from the Jewish, who has developed and enumerated specific accommodation ideas for the over 20 cancer and its treatment effect and long-term effects that we have listed on the website. So what is the job accommodation? So sometimes in order for a cancer survivor to be able to return to their workplace, part of the job may need to be changed. And so a job accommodation is an adjustment or a change to the task, to the work schedule, the work environment that allows the employee with a disability to safely and productively do their job. So we may not think of cancer as a disability, but however, if cancer and its effect or the treatment restricts the patient's ability to fulfill any aspect of their job, then cancer can be considered a disability under human rights legislation. So how this section works also along with other sections is that, for example, if an employer is completing a return to work plan, there's a specific link on the website that links them back to all of this list of job accommodation according to specific cancer-related effects. So for example, if the accommodation is building a graduated return to work plan, there'll be some examples on how to begin. There'll be examples such as beginning part-time and gradually increasing to full-time, perhaps having to change work schedules and starting late in the morning and finishing later in the day, having time off for medical appointments or moving to part-time, or having a designated quiet room for the employee to go have a rest. Thinking about having adaptive furniture, equipment, such as an adapted keyboard or a chair to support the back. Thinking of perhaps having assistive technology, such as hands-free phone. Having to modify the work environment to remove barriers. So that could be moving a desk closer to the bathroom or replacing steps with ramps. And it may need changing job tasks, such as having to reorganize the work process, perhaps replacing some tasks with less physical demanding ones, or having to delegate some duties to others. And if it needs be, it could be about transferring to another job within the same workplace. Next slide.
Often employers don't know how to talk to a survivor, and on this website we offer them some guidance and how to support an employee back to work. So things like how to communicate with the employee when they're diagnosed, off work, and on their return. We know, as mentioned by Christine, from research and business experience, good relationships and support at the workplace are very helpful for employees with return to work, and they help them come back more quickly and successfully. So we also discuss the support that comes from colleagues as well, and managers. And we also discuss support from employers can include, for example, identifying the employee benefits that they may access, so educating them, things like vacation and sick leave, disability leave, unpaid leave, employee assistance, critical illness benefits, prescription coverage, determining what types of accommodations they may need now or later, and deciding whether they want help in terms of competing forms. And this part of the website also encourages the employer to consider how to address colleagues' questions, which may impact the survivor's privacy issues, and address upfront resentment that can come from employees who are asked to increase their workload because of absence of the cancer survivor from work. So under the law, policy, and practice information, we provide basic information on resources to inform them about their duties under human rights. And this is parallel for healthcare and the survivor section, and it tells the each stakeholder their role in this process. And we've also sourced agencies throughout the country and web resources throughout provinces where they could seek out more information. Christine, next slide.
So on the website, we created, and for others, we enhanced or adapted online tools to support assessment and the return to work process. And these include the Cancer and Work Job Analysis, and there's one built for survivors and another one that's been adapted for employers. There's the Cancer and Return to Work Planner for employers, Cancer and Work Energizer and Drainer tool that will be demonstrated shortly, the Cancer and Work Helpful Thought Pattern tool Then there's the Cancer and Work Fatigue Tracking Tool that we'll show as well, and Cancer and Work Task Analysis Worksheet. And finally, we adapted a cognitive tool from Michael Fernstein, who's from the US and the editor of the Journal of Cancer Survivorship, the Cognitive Symptom Checklist tool.
So a tool initially developed by the BC Cancer Agency and translated into an online tool is the Cancer Work Job Analysis Form, which can be used by each stakeholder. A job analysis is an in-depth description of the physical, psychological, cognitive demands, temperaments, environmental conditions involved in doing a specific job. We created this in mind, realizing that not all employers do formalized job analysis. We wanted to give something that was easy to use to help them in creating one. We also designed it so that ideally the employer could do it, but if not possible, this could be done by the survivor or the survivor with the aid of a healthcare provider. It could be a good assessment tool for the healthcare provider in terms of assessing workability. By having such a job analysis available, this helps in educating the healthcare provider in terms of obtaining a true understanding of the job demands and thus being better able to determine work readiness and, if needed, show the need for potential job accommodation for the survivor to be successful with return to work. Next slide.
So featured on this slide is the Cancer and Work Fatigue Tracking Tool that's been created by the core team members and some fatigue experts in Canada. And this tool allows the patient to track their fatigue before and after returning to work. It helps also the healthcare providers to see where the interventions could be built in. And it allows for assessing the progress of their fatigue level over the course of 4 weeks and mimicking a 5-day-week job position. And so currently, the tool is still being assessed for usability and utility by one of our graduate students, but it's currently available on the website. And as you can see, it also provides a graph once the person has completed it to give them a visual representation of their fatigue level throughout those 4 weeks.
So again, adapted by the Cancer Return to Work Practical Guide developed at the BC Cancer Agency, we created an online tool to determine energizers and drainers. The Energizer and Drainer tool teaches patients to assess their energy to provide them ideas on how to conserve or enhance their energy when at work. It can also inform all stakeholders of the tasks and accommodations to help them work longer and more productivity. And it can also guide a return to work plan. So for example, if they find they're energized by taking a nap or meditation, there might be discussion for accommodations at the workplace in terms of allowing them to take a nap or have a place where they can do meditation. So they're able to work more efficiently and experience less fatigue and ideally longer. As well, as mentioned by Christine, Dr. Fernstein and his colleague we adapted their cognitive activity work tool. While this tool is being validated for those who've returned to work to help inform the discussion for the survivor and the employer about accommodation at work, we also made it as an anticipatory tool before somebody was at work to inform the discussion with the healthcare provider, potentially just for rehab referrals if needed, or to inform the physician in terms of guiding the employer in terms of restrictions and limitations to aid in return to work planning. This tool can be shared and discussed with the healthcare provider and provides helpful information in terms of return to work planning. Christine, next slide.
So in this slide, we present a few of the picture frame if you were going to complete a return to work planner, and it presents itself as a 6-step online approach. And as we said, this tool has been developed by the research done by Dr. Mary Sturgia-Kita, I think, who also presented her work in this forum in this last year. And leading this part, she worked with the Cancer and Work team to arrive at this online version. So as stated, Maureen presented some of the 3 guiding principles when building a return to work plan, such as it should be individualized, should have feedback by all parties involved who are going to be completing the return to work process, the return to work planner, and the plan should be flexible. But Besides these 3 principles, there are some specific elements that also needs to be included in a return to work plan that have been identified. Such as in step 1, shown on the slide, is knowing the anticipated start date and end date. In step 2 is about identifying the number of days and hours per day the employee will be expected to work. In step 3, as shown on the slide, is about listing the essential tasks and duties that the employee will be expected to complete. and having the anticipated schedule for increasing work hours and resuming those work tasks. And then in step 5, it's about identifying the medical restriction or the limitation, if any, that must be adhered to and how long these restrictions and limitations should continue. Step 5 is also about listing the workplace accommodation that will be needed to be implemented and the reasons why they are required. And so in this step, again, there's a link on the website that links them back directly to those job accommodations that we presented early on. And finally, the final step is on how and by whom the employee's progress will be monitored, recorded, and shared, and how the return to work and accommodation plan will be modified as required. Next slide.
So for healthcare providers, under the general introduction section, we provide a general overview of what cancer and work research is telling us. As well as in the research section, we're hoping to provide with funding support, a hub for the relevant research articles, so researchers and clinicians have an easy place to find what the research is telling us about work and cancer. Next slide.
So now the website that has been launched on October 19, 2016, so that's still relatively not so long ago, we've entered now into the website evaluation phase. And although the website has been launched, we're still feeling that we are thin on some of the sections, just as employers, and there's also other sections we would like to expand. And so we're still inviting experts to write content or to provide reviews. So if some of you would like to be interested to participate, please do let us know. We would also, what we also do with the website is that there's an online survey that when people go on the website, they are prompted to complete, and we use that to ask them, what areas needs to be adapted or improved, and providing ratings on the usability of the website and satisfaction with the website, and we'll present some of these results. But in the meantime, certainly we ask the audience, if you go on the website, what else would you like to see, and to kindly encourage you to complete this online survey that provides us with feedback and evaluation. Next slide. So these are some of the results that we've obtained among those who completed the online survey evaluation. So part of this evaluation phase was done in our partnership with one of our co-investigators, Meena Singh, who's a program evaluation expert, and she used the RE-AIM framework, looking at the RE-AIM for the reach, effectiveness, adoption, the implementation, and the maintenance of tools or intervention. And in our situation for us, it's the website. And so when since February 19, so as of February 19, 2017, there were 38 individuals who completed this online survey, with some skipping some of the demographic questions. But overall, what we're finding is that we asked about the satisfaction for the specific section of the website, such as cancer and its impact, returning to work, and staying at work. And we received an overall 90% approval for the approval of satisfaction that's ranged from 93 to 100%. We also asked about the satisfaction with the images, the color, the text size, the simple language, and if they felt safe using the website. And again, we got percentages ranging from 89 to 100%. And then more specifically, we also asked if the content met their informational needs, and we had a percentage of 77%, and then 97% who said it was easy to read. So with the 77%, what it's telling us is that although we have over 500 pages of content, we still need to expand on some other content. But the information was rated as useful by 94% of those who completed the survey. Next slide. So in terms of comments open comment that we received is that they said, so far the site is amazing. As a survivor and a healthcare employee, I feel as though all my thoughts and experiences were well represented throughout the site. I have been recommending your site at every opportunity, and I have taken a look at the website, particularly the employer section, and I am amazed at how comprehensive the information is. You and your team have done a wonderful job. And there was also feedback on, I really want to thank you so much for developing this site. I have had 2 breast cancer diagnoses and had much difficulty with my first return to work in 2008, going back, thinking I was okay and fully healed and ready, but I really wasn't. I assumed I was okay because my doctor thought I was. I didn't know anything to communicate that the reality of brain fog, neuropathy, and the extent of fatigue, and in reflection, PTSD, so post-traumatic stress disorder. I'm now looking at my second return to work, and I'm so grateful for the open-ended responses were solicited for quality improvement. So some suggestions that we did receive for improvement that we have actually acted upon for some of them is that including providing French language translation. So we were successful in obtaining additional funds from CPAC, and the website is almost completed in terms of translating it to French. They also asked to provide more specific information that relates to Quebec pension plans, so we did add that. They wanted more specialized topics on the young adult population, so we have yet to work on that part. Self-employment and cognitive challenges, so we'll continue extending that. And providing more links to community, vocational, relevant healthcare resources, and providing examples of a return to work plan, a complete return to work plan, and more testimonial from survivors during and after the return to work. So as you know, we'll discuss, we do have plans to act on them, but we have some challenges and we'll discuss them. So next slide. So on this slide, again, using the RE-AIM framework and speaking to the REACH, and this one, what we're seeing is that in regards to the website views, we have over, to date since the launch, October 19, over 8,300 views of the website with 36,000 over page views. 35% of individuals coming to the website went to the survivors page views, 12% went to the healthcare providers and sending to the employers. Over 7% went to the tools and 4% went to the French side. Next, and then as you can see as well, in terms of the characteristic of the individual, mostly was Canadians. From over 50 cities, the website was viewed with highest in the major cities such as like in Toronto, Ontario, Quebec, and BC. But we do have, as well as you can see, some external views from out of country, from US, Russia, Italy, Germany, UK, and Saudi Arabia. So we thought that was interesting. Next slide. So here we were fortunate to obtain funds from CIHR that will now allow us to provide some knowledge translation training workshop on how to navigate and also to do some usability testing of the different components of the website. So you can register directly on the Cancer Work website for the coming workshops. So we have one that's coming up and we're still recruiting in Vancouver on May 1st. And the second one on May 5th, that's organized as part of the CAPO conference. Then we also have another workshop organized as part of the CANO conference that's held in Ottawa-Gatineau. CANO is the Canadian Association of Nurses in Oncology. So that will be on October 26th. And then we have also partnered with the Partnership of Workplace Wellbeing, which is at St. Mary's University under the lead of Dr. Lucy Colcom. And she will also be providing a workshop in Halifax in June. And in Montreal, we are planning for a workshop in November. And now possibly we're looking into providing a workshop in Toronto. We're currently applying for additional funds, and we should hear in about a month if that's possible. Next slide. So in terms of our challenges, so as you may imagine, our grant with the CPAC is coming to an end this month. And so in order to see this work not just stay stagnant, but be able to expand, we're going to be needing not just looking for granting funding opportunities, but also sponsors. So as you may realize, there are many economic gains in keeping this website going and alive, but without having funders or sponsors, this will be difficult and challenging. So we're very much looking into working hard into getting some more sponsors to keep this website alive. And as we know that the website information is helpful not just for cancer survivors, healthcare providers, but also for insurance providers and employers who we see are bound to lose a lot if this website disappears. So next slide. So here we're coming to an end to our presentation, and we certainly look forward to your feedback. And again, we strongly encourage you, if you could, to complete this online survey. Take a look at our website and complete the online survey, provide us with feedback. And if you're interested to participate some of the writing, we also welcome those. So thank you all for this opportunity to present. And now we're happy to answer the questions.